The thing that really challenges our city, but really across the country, is really health disparities. And how do we make a dent on especially the racial health disparities that exist in the country? That's one issue. The other issue is, I believe that public health has to really become better at addressing these complex social problems, and that it's really going to involve our recognition that these problems are complex, that it's going to require collaborative partnerships, and that we have to take a collective impact approach to these partnerships. And I think this is a new way for us to operate in public health. I think we're really good at the categorical approaches to public health when we're focusing on a very specific problem. But in these problems that are really cross-disciplinary, multi-sectoral, that involve social problems, social determinants of health, it's really about bringing partnerships together and collectively aligning our resources and our activities to make a difference. It requires a different skill set. And so no individual or agency has all the skill sets that are necessary to pull that off. So I feel like that's the future of public health, is our ability to really do that kind of work. The thing that I'm most proud of right now is that we've come to recognize that in order for us to begin to make a dent on health inequities, we really have to deal with some real fundamental social and relationship issues. How different ethnic groups talk to each other, how we begin to have difficult conversations. We cannot build trust with communities unless we know how to develop relationships and build trust with the diverse staff that we have. And so that's actually been, for us, that's been an important realization, that we have to transform our organization before we can transform a community. And so now we have embarked on cultural humility training and trust training for the whole organization. That it is a foundation that's going to allow us to really address the more complex issues that we have. Another part of, in addition to the cultural humility training, we're also becoming a trauma-informed system. So we're learning to address and identify trauma across, not just with clients, but also with our staff, and to understand the complexity and depth of experience that people have that you often can't see. And how do you close the gaps? How do you build those relationships? How do you build the trust? Fundamental, absolutely fundamental, because if you don't address that, the most innovative ideas are not going to take hold if you don't have the trust in the organization.